And hello, we are here with FSCDR, Warriors Within. We are here with Patricia. How you doing today, girl?
I'm okay. How are you?
I'm good. So listen, I've been diving into these topics real good, and I'm happy that you are here to join me.
Thank you for having me.
We are just now starting this podcast to make awareness because it's no awareness about our little sickle cell warriors, and I love my warriors, and I want you to elaborate on some topics with me.
Okay.
I want to dive into let's start with physical. How does sickle cell physically affect you? Well, how has it affected you from an adolescent to adult? Let's start with that.
Okay. So let me go back to So let's start with elementary school. No, before elementary school. So, my dad has the disease or had. My mom was a carrier of the trait. So I have an older brother who's like 15 years older than me, like 14, 15 years older than me. So he has sickle cell. So when I came along, they pretty much knew that I had it before I was even here. So it was kind of difficult going to school. I ain't gonna lie. It was a little rough. When I was 4 years old and was ready to start preschool, my doctor said I couldn't. So because the kids carry germs, and so I was homeschooled for preschool. But thank God I had my grandmother. She was a first grade teacher.
Okay.
So I was homeschooled pretty much for preschool. But by the time I started kindergarten, I was ahead of the kids.
Yep.
So I did pretty good at school. It's just I wasn't never there.
Yeah.
'Cause, sickle cell got unpredictable crisis.
And you're here one day, gone next week, maybe there one week.
Right.
Not
You
there
don't
next
know.
week.
You don't never know. Like, it's like I was the sick kid.
Yep.
So I was always good in school when I was there. Like, smart, I guess, high IQ on paper. They wanted me to go to a school for gifted kids.
Okay.
However, my parents didn't want me to fall behind because I had sickle cell and I would be in the hospital,
Yeah.
I'd be sick. So I stayed at the school I was at, and I was, like I said, I was ahead. But it was kind of difficult when it came to the other kids because, kids, how kids can be like, you never hear.
Yeah, what's wrong with you?
You're like different.
You're privileged, different.
They like, and they don't know what it is. A lot of people still don't know what sickle cell is, unfortunately. However, when I was in school, I learned to kind of cope with comedy, and I would just make my friends laugh. So once I found my core group, like my core people, but I was cool with everybody, but I had my core group.
You always have that one, the ones that understand you fully,
Like, I didn't even have to explain, because sometimes it'd be like, oh, you sick again, you not in school again, you in the hospital again. So that was hard when it came to making friends, but, everybody loved my personality. So, so it worked out. So fast forward to, let's say, middle school. Middle school, I go to school, and let's say it was urban to be PC.
Yes.
Because I wanted to attend a magnet school for pre-med.
Okay.
I was always interested in healthcare and medicine. My mom's a nurse.
That's beautiful.
So, mom's a nurse, dad's a pastor. Mom's also a pastor, however.
Yeah.
That's my background. So I grew up in the church. So I go to this school in the hood, and I realized that a lot of the kids would get treated differently. Like, when I told people where I went to school, like, oh, like, that's in the hood. Like, what you doing over there? And it's like, I understand how it is to be treated differently.
Yeah.
So
it didn't really bother you like that much because you already have something that's treated, a disease that's treated differently, and so you go into another, like you said, to a school where you're treated differently too. So it kind of didn't give you that much unease.
Right. So I learned how to treat other people, like, I treated everybody the same. That's one thing everybody loved about me. Because whether you in honors classes, whether you just there and you got a 1.7 GPA or whatever you got, I treated everybody the same. So everybody pretty much loved me. I just wasn't never there.
Yeah.
So I learned a lot about life during that time, and I learned how to deal with different people with different situations.
So do you feel like in middle school, because of having this condition and because I feel like, honestly, you saying to me that you went to, I understand what it's like. I was the kid too that was always, I went to suburban schools, but I was also the kid that, you know, I had the friend. I stayed in the minority area, so I understand that.
Like, I ain't really from the hood, but, you know, I got friends and family.
Yes, family.
I'm hood adjacent, I guess.
Exactly. So do you feel like, even though you attended schools like that, which we're going to say, which is, like I said, minority schools that are filled with us, that they understood you better than what you probably would have been if you were in a different school?
Yes.
Okay.
I would say 100%. Now, don't get me wrong, kids was a trip.
Of course, kids are kids. You can't expect kids to when it comes to that, I accepted that kids don't fully understand. Yeah. When you're young, that's something it's kind of like how parents want their kids to be taught how to treat their kids who has autism or anything of that need. Those kids definitely need to be taught the same way when it comes to sickle cell, because for a while I had my son walking around with a water bottle and nobody understood why he was walking around with a water bottle, and then he became the funny kid walking around with a water bottle. I don't care, he's the funny kid walking around with the water bottle,
because at the end of the day y'all not gonna be in the hospital with me.
Exactly.
Is it?
So do you feel like you got more, I want to say, community support from your school? Because I do feel like having that type of different upbringing, if you if you attend a school with like a magnet program, those higher end schools, you don't get that same affection, attention, attentiveness that you would get if you, you know what I'm saying? Community wise, attending an urban school, they have knowledge, they have understanding to that. Opposed to these kids that's going to other schools that will have these conditions, they don't have that understanding. So do you feel like you had community help within your school?
I did. You know, once I found my people, you know, my core group, they understood, but also because the school was like 99% black, a lot of the kids had, you know, kind of knew somebody that had sickle cell, or they had a trait.
You had a cousin or something.
You know, they know somebody, so they kind of understood. Like, Patricia ain't here today. She ain't.
Don't play with you like that.
You know, but they ain't really, as opposed to like some other schools, they be like, oh, well, why aren't you in school? Well, what happened? Well, you missed X amount of days. Yeah, so I will definitely say they did provide like a sense of community, as far as people that look like me kind of understand because they have family, you know,
So
sure.
Did you prefer homeschooling opposed to regular basics, or, you know, the common school?
See, now that's the thing. So I loved the homeschool because
you do what you want.
Right. You do what you want. You got a little bit more leniency, some freedom.
Talk to your teacher on the phone. You don't have to deal with it. I know.
Right. You talk to your teacher once
a month.
Do this little discussion,
yep.
basic assignment. You know, I like the homeschool because I didn't feel like I was behind, but also I was kind of like my mom say I'm a social butterfly.
Yes.
But like if you first meet me, I look reserved, I look quiet. But like once you start talking to me, then that's when I kind of, you know, start thriving. But I really did want to be homeschooled for the longest time. But my mom kind of convinced me to stay in school, get the sense of community. But also, with being in school and missing a lot of days, it kind of took a toll on me because, you know, I have family saying I'm smart. I have teachers saying I'm smart. I've taken IQ tests and all these things. However, when I'm not there, I'm behind, I'm missing information. And it's like, dang, am I dumb? Like, is it me, or like, I wish I could be in school more, but I can't. That's one thing all my teachers like, Patricia's amazing, you know, she's so smart.
We wish she was here more.
We wish she was here more. That's the only thing. It's like, I can't. So it was a little tough trying to overcome that. So I was like, dang, am I dumb? Like, you know, am I smart? Trying to figure out, you know, where I belong. But after middle school, really high school was a little bit more diverse.
Okay.
But also it was, you know, a little bit more suburban kids. And also they had this like 13-year club because I went to Nova. So if you had been through Nova from elementary school, middle school, high school, they called it a 13-year club. So once I started going there, I already felt kind of excluded because I started going there in 9th grade high school. Everybody already knew each other. Like I had like 2 or 3 other people that came from my school because with Nova, it's a lottery.
It is. So
you can't just, I'm going to sign my kid up for Nova. It's like, no, you got to get picked.
Yep, you got to get picked.
So kind of, it felt like cliquey a little bit. So
which makes it, I can understand the dynamics, especially with that. You transition into something totally different.
Mind you, I was going to school in the hood.
Yes,
so
that's what I said.
From the hood to the suburbs a little bit. They already got their little friend groups. They got their tribes. I'm trying to build mine. So they had this little like the New to Nova program, and that's for the kids that like that was your first year in Nova. So that kind of, it got us out of class, and we would kind of like a social hour kind of thing. They had different events and stuff. But yeah, it was, that transition for me was hard. But again, using comedy to
that was your coping mechanism. So comedy was your coping mechanism. Because like I said to Shantia, every sickle cell warrior, they have a coping mechanism. And in order to know you guys is to know that, to be honest. To everyone, it's nothing wrong with it. Some of them have coping mechanisms of just sitting at home watching movies all day. I love that. That's cool with me.
Like chilling. I ain't bothering nobody. I'm in my little corner. I'm doing my thing.
And I guess what the problem I used to ask with myself, or trying to get an understanding of how to understand your coping mechanism.
Right.
Because you aren't the same as everybody else. The way I cope is going to be totally different from the way you cope.
Exactly.
And the way I cope is not going to send me in the hospital. It's going to send you in the hospital. So dive on this aspect for me. How did that help you, like, with having, because you are a social butterfly. I totally see it. I get it, me all day.
We had some conversations off camera.
Yeah.
We've been talking.
So how did you dive with that? Like, it's being, let's say, like I said, even like I said, we're talking to Chantel, going outside and going to your parties, and the next thing you know, hey friends, I kind of gotta leave. Like I can't. I gotta remove myself. I don't feel good. And if I don't leave right now, I know in the next 10 minutes, y'all gonna be calling my mama or somebody to come pick me up, or an ambulance. So how did you deal with that? How were you coping with making those jokes as your exit move?
So really, I gotta give praises to, first off, I gotta give praise to God for giving me the gift to kind of talk to people. But my parents, really, my mom was a nurse. She worked a lot, so I was with my dad a lot of the time. And you know, I told you he a pastor, so he kind of take your child to work days every day. So I spent a lot of time with my dad, and he, funniest person I know, not the typical pastor. You know, he got a past, became a new person, and really, it was him, like, instilling stuff in me, like, I don't want to say stuff, but instilling those different things into me, like, you know, I was a plus size girl, still a plus size girl, lost some weight though, but 120 pounds, thank you.
It still goes.
Listen, we still going.
It's something.
But my dad, I gotta give him credit, because not only he made sure to instill in me, like, you're beautiful, you can do anything, you're smart. He really, I want to say, he cemented that in me. Like, the comedy I got from him, it was just, my whole family's a trip, for real. I would say I'm the funniest, I ain't gonna lie. But really, I took that and decided, like, okay, you know, this stuff I'm doing at home, let me take it out into the real world.
Yeah.
So when I would go to school, I would really, I ain't gonna say I would pick my target, but I kind of would pick my target if I can see, like, you got a good vibe, you got a good energy. I'm like, okay, I got my eyes set on you. Like, I'm like, okay, Coco seemed cool. She to herself, she not really mixy. I'm like, okay, Coco. So I'll be in class and I just say something like to myself, talking to myself out loud, and then people hear me.
Yeah,
that's really what I would do.
And they just chime in on whatever you have to say.
Yeah, you know, say what people thinking, and then it's like that kind of breaks down. It's like, oh, how are you? Like, oh, I'm Patricia, you know. And then that's really how I made a lot of my friends. Like, that's how me and Shatia got close. Like, we really, that comedy was really my coping mechanism for real.
So did you have friends that would come visit you often when you would get sick?
I did and I didn't. I say I did because in middle school, I kind of was more open to having visitors then because, like I was like 13, 14 in the hospital. And, my friends brought me cards, balloons, stuffed animals, all type of stuff. I had great friends. I have to give all of my friends props. Like I have a good support system.
That's good.
But also, it's sometimes I don't want people to see me like that. So
course.
I don't want visitors all the time.
The physical aspect, because that's the part where I feel like as a woman, because I feel like women are tedious when it comes to certain things, but of course that's the part I really want to dive into next on that part. Physically, how did you? Because you have a good support system. You have people coming to see you, coming to check on you. How do you cope with that? How you deal with that?
It was hard. I'm still learning. I'm still learning boundaries. I'm still, learning and studying boundaries because it's sometimes I don't want to be around people. I don't want to be social. And I had to be honest with myself. It's like people expect me to be laughing and smiling because I'm always joking, but it's sometimes I don't want to be laughing and smiling. I don't want to talk to everybody. So if I don't want visitors, I don't want visitors. So, but my friends are pretty good with understanding that. Some of them still pop up. Like, I got to turn my location off for some of my friends.
You need it, though. I'm not going to lie. You need it. It's a sense of, hey, you're not alone.
Right.
Because sometimes I know, like I said, I notice with a lot of my sickle cell warriors, isolation is very real. And you will isolate yourself to the point where nobody can contact you.
Listen, and my family, still to this day. Your phone don't do nothing.
I need that phone to not be to work. I can't have no way not contact you. It makes your nerves bad. So I told
the mama coming out and Coco.
Yeah, it's serious. I totally get it.
Yeah.
So now I want to dive into sports. Because usually they always dive into, you can't do this, you don't play this, you don't do this. So did you partake in any sports? Did you do any activities? Did you have, because if obviously when you sit there and say you're smart, they want to throw you into everything. They always want to throw you in something academic wise.
Yeah, they be like, I want you in my class, I want you to do
this.
Yeah, but sports, not too much because I ain't gonna lie, I didn't want to be in school when I ain't have to be in school. So I didn't really have that much school spirit. So, but however, like I said, my parents are pastors, so we have a church. They've been in ministry for over 25 years. So I started out praise dancing ever since I was a baby, for real. But I didn't feel obligated to kind of with school sports.
You
got the schedule you got to adhere to. With dancing in church is okay. I can be a little bit more lax. I can dance when I want to. I can pick this and this, and also I can kind of balance more. It's not as restrictive as you got to do a physical to play football. You got to listen. We got 20 games. You got to be at all 20 games. No,
at least with your church, you kind of agree. You got a community, and it's not like you said. It's not stable and steady and mandatory like how it is in school. So how did you stay active? When you would stay active in church, how did they support you? Was your church really supportive of when you got sick and of your family?
I would say because they've known me. My parents started the church in 1998. I was born in 99. So most of the people have known me since I was a baby. So they know and understand. It kind of, I don't want to say it was hard. It was a little challenging when you're trying to keep the faith. So people don't really, some church people don't understand, the super religious people are like, okay.
That's why I said dive into that topic.
You need deliverance. Yes. But the way I look at it, I'm like, okay, maybe God gave me this for a reason or allowed me to have this for a reason. Because the people I've met, just even in the past 2 years, my life is really
different.
Yeah. my adulthood.
So where do you see implement for, I'm going to say, let me ask this question first. Have you visited other churches other than your own?
Yes.
Okay, and have you ever seen a community in the church community that advocates for sickle cell as well?
Not many.
Okay.
Not many. However, a lot of, pastors, again, because we're in South Florida, a lot of minorities, they kind of have heard of it, but it's still a lot of people that don't fully understand it. They don't know what it is or the extent of it. Even I have friends still to this day.
I do too.
Still don't understand how bad it gets because I don't like to show that to them. I just like to, isolate, like you said. So I think, no, they don't really have, specifically, we're advocating for sickle cell.
Yeah.
But, no.
So where do you feel like, as a sickle cell community, where we could kind of push? Because now we're gearing toward positive things at this point. We're getting toward more help, more, centers for us at this point. Where do you feel, as in for a church aspect, where could they help for sickle cell warriors?
Well, that's a good question. I think I would say reaching out. Just reach out, because sometimes you don't know the extent of. We don't know how bad we could be in a crisis and think it's a typical crisis. You don't know. You can be here today, gone tomorrow. So I think just really tapping in, making sure, like, okay, you're good. Do you need anything?
Yeah.
Most of the time, I personally don't need anything.
Yeah.
But I think just to know that it's people that care and people that, want me to be healthy, want to see me do well. I think that has been.
I totally agree with you on it, because normally I let my church family know whenever my son is sick. All my son is like you said, you guys never need anything, but you guys just ask for prayers.
Oh, that's my mom. She'll tell everybody. I was in the hospital back in November. We're in January now. So somebody texted me, was like, "Oh, how are you?" And once they said, "How are you?" I already knew my mom.
Yep.
So I'm like, "Mom, why are you telling people I'm in the hospital?" She's like, "Girl, I had to call the prayer warriors. I need some people that can pray."
Yes, you do. You have to. I thought it was a joke at first. My mom, I have the biggest support system when it comes to my sickle cell warriors. Yeah. So I'm big on support when it comes to it, because I feel like if you are cooped up in that hospital with them four walls, you need support. You need somebody to come tell you, hey, you okay? I don't care if it is to watch them little boring movies on the TVs with you. You need somebody to watch the boring movies with you. You need somebody that's going to bring you a smoothie because you tired of eating the food in the hospital. You tired of being constipated from all the medication. So at first I thought I really didn't chime into the church community. My mom did. And so I totally understand you on that, because at first I would be sitting there getting all these text messages from the church talking about, hey, are you okay? And I'm like, I just want to be alone with my baby, and he don't want to talk right now, and we don't want to talk. So I totally get it. And it is a little overbearing at times when you aren't feeling the best of health, and you got everybody reaching out. Yes, and reaching out. But I do admit, I agree that the prayers are abundance. The needing and the factor of just knowing that someone is there and keeping you in the thought process of their day is great. I love it. Now, I want you to tell me, everybody has an experience. I always like to know every person's experience when either they had a challenging time in the hospital. As I talked to Shantia, peds are very different from adults. So dive into that. How has that been for you? What was your transition like? Because like I said, everyone I know, their transition from a kid to an adult is different. How was that transition for you?
So going back to high school, I wasn't really hospitalized a lot, but I still went. However, really, I did pretty okay. Once I got to like senior year, that's when it kind of like, okay, I need to stay on top of my health more, because 2017, I was working. I've been working since I was 17. So I was working at a park, at a county park, and we had this Renaissance festival. And it's like everybody got to work. We need all hands on deck.
Oh man.
So basically, there's an entrance fee when you come into the park. So we're letting cars in, taking the entrance fee to get through the gates. Yeah. So we had these tickets. Like, we're not even doing it directly way in the booth. We are outside in the heat for 8 hours, talking to people, exchanging money. And after that, I remember it was like February 2017. I had to go to the hospital because I had pneumonia, went into a crisis, and I think my spleen was enlarged. Ooh. And yeah, I had a lot going on.
I'm going to stop you right here.
Mm-hmm.
Explain what a spleen is, because a lot of people don't know when you say my spleen was enlarged. Tell me what that means.
I forgot what your spleen is. Your spleen, it's a production of, I forgot, what is it?
I know,
it's on the tip of my tongue.
I know what you're going to say. To educate them for a snippet, a spleen is a part of what you have to check for. It's on the side. Yeah. A lot of people don't know. You have to they tell you feel on the side, and if it's enlarged.
I think it's the right side.
Yes. If it's enlarged, that lets you know that it's something, you're wrong. You're going into a crisis. Something's off.
And you can't live without a spleen. And a lot of sickle cell patients do have to get it taken out. Mm-hmm. I still have mine.
Okay. It was just, so that's just an FYI for my YouTubers right there and the followers right there, so y'all know what a spleen is.
Yeah, I'm sorry. I'm blanking on exactly what it is.
So you guys,
I promise y'all, I know. I just can't.
But go ahead, continue. So you got sick. You had to go into the hospital.
So I got sick. I was in the hospital for 2 weeks. I don't want to say COVID-like symptoms, but I had like COVID-like symptoms.
Okay.
I didn't have an appetite, couldn't taste, smell. I had a headache, all type of stuff. Like when you came into my room, you had to put on PPE. You had a mask. They even had gowns to come into the room. Like the CDC was like, okay, we're kind of quarantined. I had a private room because they didn't know what was going on. They were like, we're giving you antibiotics. You still have a fever. They gave me antiviral medication, antifungal medication. So yeah, I was there about 2 weeks, and it took me a little minute to kind of adjust and jump back into my regular day-to-day. It took about a month, I would say, to bounce back from that. But in April 2017, my dad passed away. So
sorry for that.
Thank you. I was starting college that fall, and my brother was like, you need to take a break. Like, you was going through a lot. You got the sickle cell, you got you're grieving, and it didn't really hit me yet. So I'm like, nah, because if I take a break from school, I ain't gonna go to school. Like, I wouldn't want to make money because I was working.
Your body.
Right. So I think once the summer was over, I started, because I had gotten into Berry University with a scholarship, and I was driving to and from Berry every day. I live in North Lauderdale, driving to Miami Shores every day. And
God bless your soul.
Yeah, well, I like driving. At the time, I like driving. But I got into 2 car accidents within a 3-day span.
Oh my goodness.
So after that, it was a lot to, it was a lot. It was a heavy year. This is my first year as an adult because I had just turned 18.
Yeah.
And my birthday was in February 3rd, 2017. I turned 18. Okay. So, and when I was hospitalized that time, that was my first time being hospitalized as an adult. So I didn't have the peds because they treat you real good in peds.
Yes,
if y'all don't know,
I've heard
that you live in the sweet life. You got room service, your medication,
and they bring you ice.
They bring your medication. You ain't even got to call for it. They bring. Let me stop playing.
Yeah, no, they bring. Listen, I'm telling you,
they treat you real nice.
They do. I've heard that too. I've heard it too. I'm there for moral support of my baby and the popsicles. I'm not gonna lie. I'm there for the popsicles and the juice.
Crackers.
Yes,
and
agreed. So they don't give that to you when you get to adult factor.
Man, wait. You get a cot and a blanket.
Oh no.
So yeah, they treat you real nice and peace. They're like, oh, whenever you ready to eat, just call this number. You can tell them what you want. They bring it to you. So it's real. You think you at a hotel, like, okay, this all-inclusive resort. Agreed. I'm on vacation, even though I'm sick.
Agreed. I do agree.
I ain't really had too many battles with my pain medication, nothing. Because I didn't start really, I don't want to say managing my pain, but when I really, I'm on, like, got a regimen, I was an adult. So in peace, I didn't really have that. But when I was in the hospital, like, they was treating me good. So I
want to dive on this topic because when you brought on this. So when you said growing up and being into peace, so now let's talk into the topic of when you being a woman and getting your menstrual.
Oh my God!
How does that affect you as a sickle cell patient too? Because that's something I never even thought of, dived into. Like, would your flows be heavier? Remember, because they're saying it's a blood disorder. So when you think kind of like, well, maybe my flow wouldn't be as heavy, or maybe my flow would be heavy, I gotta be careful. Can cramping send you into a crisis?
Listen, anything can send you to a crisis. The wind blow too hard, you can go into a crisis. So, I was fortunate enough to have multiple people in my family that have sickle cell. However, they're all male. My grandmother had it, but she passed away in 2008. So I couldn't really get her perspective from a woman. So between my dad, my brother, and my uncle, I have stories. They take care of me, make sure I was good. But when it came to being a woman and getting a menstrual, because, I know the guys get priapism, and I know that's painful. However, with women, I've always had a heavy flow. I've always been irregular, like blood clots, even still to this day. Like they put me on birth control at 16 because of the bleeding. So a lot of sickle cell patients have iron overload, so they're producing too much iron. I'm iron deficient. Yeah. So sometimes I have to get iron transfusions as well. So when it came to the menstruals, when they were regular, you're getting them every month, you're losing a lot of blood because I said I have heavy bleeding. A lot of people didn't really understand that, because I was being in a lot of pain. Like, people was like, dang, you always in pain. But
because you get more cold. That's what I would expect.
Remember, you're anemic.
Yeah,
but also you on your period, so it's like you double anemic. So people don't really understand, like, being a woman and getting the menstrual with sickle cell. Start PMSing a week before your menstrual starts. Then you have the week of your menstrual, which for me, I've always had like the whole 7 days, so I had a whole week. So then the week after that, I'm trying to recover. So it's like, dang, do I really get a week to myself?
Do you get your week to yourself?
Like, it's always something. And people like, oh, you always in pain. It's like,
like I can't be happy. Of course, because that is a lot of blood.
Like one time, I had a menstrual and it was on for 3 weeks. I went to the emergency room.
Jesus Christ.
Yeah, and they, did a full pelvic exam, did an ultrasound. I did a transvaginal ultrasound at 16, which I didn't know wasn't really recommended because, I was still a virgin.
Yeah.
Still am to this day too, But anyway, it was really bad, but they said I had a cyst on one of my ovaries.
Oh, no.
So, but it was small, so I didn't really have to do anything. So, they put me on birth control to kind of manage it. But, so that's how it sends you into a crisis for sure.
Yeah, no, okay. So, definitely. So, that's something that I wish a lot of people would really talk about because I don't think a lot of younger girls that have sickle cell are aware what they can embark into when you come into that womanhood because again, remember I said my situation is always going to be different from yours, right. and so is everybody else. And so if let's just drop a gem for our younger ones. If it was anything that you could tell them, younger sickle cell warriors, when I say them, is there anything that you could tell younger sickle cell warriors, like just drop a gem, a word of advice for them, girl-wise? What would you tell them?
With the girls, I would say, if you feel like your body better than anyone, so if you feel something that is off, it probably is. So make sure you have not only a support system like your family, friends, but also make sure you have a good healthcare team. Yeah, the healthcare providers. Like a lot of they're good ones are hard to find.
They really are.
Like know their stuff and are personable, because you got some that are personable but don't really know. They go by the book. They like, if it ain't in that book, they don't listen. If they say your count is normal, hey, we sending you home but you in a crisis.
Yeah.
But make sure you do the research to find a provider that fits you. Because it took me a while. It took me.
It does take a while.
I went through transitioning from peds to adults, which nobody told me it was gonna be hard like this.
Yeah.
But find that team, find a provider that really resonates with you, that can understand you, knows you. Because sometimes doctors see, like, I work as a scribe for OBGYN. They see 30 and 40 patients. Sometimes you my 10 o'clock appointment, and that's it. Make sure you build a relationship. Make sure you have a community of people that really support you. And if your body feels off, let them know. It probably is. You never know. Like I said, you can be here today and gone tomorrow. So make sure, don't be like me, because it took me a long time to start really, okay, I'm going to go to the emergency room because,
Why so late? Were you not, like, you didn't want to be in the hospital? Is the hospital, like, draining for you?
It was a lot. It was, I would say, like, PTSD, because I had doctors that don't believe me. They think, being a black female, they think, oh, you just want to pain meds. Or like, oh, you're a frequent flyer. Oh, they have these little stereotypes about sickle cell patients. Like, oh, they're rude. They just want their medicine.
They're groggy. So, I've heard that before too.
But it's like with cancer patients, they don't
say that.
They don't say that. And they either unfortunately either pass away or go into remission. We're on this medication our entire lives.
Yeah.
So the hospital, it was a lot. It was a lot. It was for me to go, especially because when I was in peds, they were like, oh, we have a new protocol, and for sickle cell patients, we're giving them fentanyl. But not only were they giving fentanyl, they would put it up your nose like a nasal spray, like Flonase. So
literally. It's the most scariest. It's the most. I've seen it so many times. It's the most scariest thing ever. As a mother, when I seen it for the first time, I was like, "This can't be for real. It cannot."
Really, and that really scarred me, because I really felt like, dang, I feel like an addict. I feel like what they say I am.
Yeah.
And I remember I was crying to my mom. I was like, I feel like a druggie. But I was really that was like, that happened when I was like 14, maybe. I may have been younger, but. Thank God I had, a good family. Make sure when you go to the hospital, you got somebody with you, because they will try you in these hospitals if you by yourself.
They surely will.
I don't want to say leave you for dead, but they will leave you out there for dead. So I would make sure to have somebody with you, somebody that can advocate for you, because you're on this medication. Sometimes you're not able to advocate for yourself.
Agreed.
If the medicine not working, I'm allergic to morphine. They trying to give me morphine. Like, no, my throat was closing. I literally had a hematologist that I was seeing. She was prescribing me extended release morphine, and I told her I was allergic. And, right, I didn't even pick this doctor. My doctor retired, and she happened to be the doctor that came in and took his place. So she was like, oh, we're going to put you on the morphine because my insurance didn't cover the previous medication I was on. However, there's a million medications out there, so find something else. So she put me on the morphine and literally said, oh, take some Benadryl with it. Like, if my throat is closing, how am I going to take the Benadryl?
Yeah, you need some IVs.
So after that, I was like, I'm done. This ain't for me. So I was like probably 19, maybe 20 at that age. And again, I'm still trying to find my little,
find your niche.
I'm trying to find my team that's like, okay, I need some healthcare providers that know their stuff, know me, and can understand, because that is ridiculous. Why would you put me on a medication I'm on? That's negligence. But anyway, so finally, I was Googling sickle cell clinics near me, because the one I was going to closed, and the foundation popped up. So I was like, well, let me give it a try, So I went there, and I was like, okay, I like what I see. They have different medication, different options. It wasn't just like a one-size-fits-all, and that's what I really like. So I was like, okay, I'm going to go in here and get my little treatment. I'm going to just, be to myself, just, However, I thought I was just gonna be, quiet. Look.
You thought wrong.
I did, because they suck you in. We're at the foundation. It's a family. Out little dysfunctional, but we all work together. We love each other. It's really love.
So you know what? I'm gonna stop right here, and I want to come back to this community of the foundation, and I want to know how the foundation helped you cope with this PTSD and not wanting to go to the hospital no more. Okay, so we'll be back. And we're back with Warriors Within. Patricia, you are killing it with me right now. I'm loving our conversation.
You're amazing.
So let me tell you, I really want to talk onto this topic real quick, and I wanted to kind of close it out with this.
Okay.
Tell me how hard it was for you. You said you were working at 17.
Mm-hmm.
So working at 17, transitioning from a working kid into college, and then now here. Let's talk about how has working at 17 been hard, and then not only that, because let's talk about it. People with sickle cell, they're not supposed to work their full because you can get sick at any moment. And then let's talk about going into school, because school is kind of similar to that. You have deadlines, you have tests that you have to be meeting for, final exams, teachers. Where do you feel things like that, where could be help needed in those aspects? Like as in for workforces, should there be a special case for sickle cell? We only allowed to work this much, and this is where Social Security is supposed to chime in. For school, we can only do this much, and if I'm sick and I can notify my teacher within this time frame, this final should at least be pushed back 2 weeks so I get my mental and my body physically up. Where do you feel like these positive things could be implemented in work, school? Where do you feel that could work?
So going back to working at 17, it was challenging because I was working at a county park, so we have events. I'm setting up, breaking down. I'm standing on my feet for 8 hours, like not sitting down. And it's a lot. You got to be able to lift stuff. It's a lot on the body. It was hard because anything can trigger a crisis. You don't know, and even being 17, trying to communicate that to not only employers but also the college, the people that work at the college, school. Like they don't really have like a individualized plan for like college students, and I think that would be very helpful because sometimes we're in the hospital, and I may have a final, I may have a midterm, and even if I do get out before the midterm, I'm not 100%. My mental is still lacking. I literally had to email teachers and say, hey, listen, my mental health is terrible. I can't even. Yeah, and I had to take a break from school at that. But also I've had this kind of push and pull because I'm trying to finish school. I'm still trying to finish school to this day. I got $20,000 in student loans, still trying to finish. However, I didn't quit.
You're going to get it done.
In Jesus' name. But trying to work to pay for school, but also trying to, like, I really want to be in school, but it's like, I don't have the money for school.
Yeah.
And then
the energy,
with
the time,
the energy, the mental, the physical, even, with Social Security, like, I didn't start getting any type of payment until, like, 2021.
Really?
Yeah, and I've been applying since I was, like, at least in high school, but I'm pretty sure before that. So I got a little bit of back pay. It wasn't too much, but I thank God for really sending the foundation. And also, shout out to Tia, because she's really been helpful. Like, hey, you have sickle cell. You should be getting X, Y, and Z. Or let me show you let me tell you what to do. Because she literally helped me through the process. Like, because I'm like, dang. Sometimes you don't want to ask for help because it's like,
you don't.
Just feel like,
embarrassing.
I should already know.
Yeah.
But I didn't. There was no one to that helped me hold my hand and walk me from PEs to adults.
Of course.
So that whole transition was really, it was a lot. It was a lot physically, mentally.
So overall, we're going to say that they need to start implement. It would be helpful if they could implement for sickle cell warriors in school to having a 504 plan. All right, am I saying it right? 504, right?
Yeah, I think it's 504.
All right, so that
IEP.
Yes, that implements for them to have the extra extended help if they get sick, and even in workforces, because I wasn't aware about Social Security either until honestly I found the foundation. So let's be realistic.
Honestly,
I didn't know that was owed to your child until then.
Right.
So I agree with you. Until you find your community and your foundations, then you don't know these little gems. So
yeah.
I totally agree with you. They do. These are little hard gems. That's why I'm happy you came in and you talked about these little gems that's needed, because we're here to make awareness about these things, and we're here to not. Your voice ain't the only one,
right,
to be heard, because everybody else feel the same way. And
even working for sorry to cut you off.
No, go ahead.
But working other chronic illness patients, just like a little something that like you can kind of, I guess, like filter out, like, okay, this job, I could probably do this job.
Yeah.
This matches with this. If they had like something like that, that would be good as well. But also you have to also be careful if you are getting any type of government assistance. You can't make X amount of dollars. Like you can't go over that amount. So it's kind of, again, they don't give you enough, or you're not getting everything, or you're trying to work, but it's like,
it's not
working, you cancel
enough.
out the help. It's like, I need the help. I need both, really.
Yeah.
So even with your prescriptions, like I didn't know I can get help with my prescriptions and lower the cost. It's a lot of stuff that people don't tell you, and it's like, it's not that people don't know, it's that you have to be in contact with the right people to guide you. And again, like I said, I really thank God that this happened for a reason. I think I have sickle cell for a reason.
Yes.
I think I met the people at the foundation for a reason. I didn't even think being here today is, a gift from God, really.
It is. Yeah. And trust me, having you here has been more than a gift. And I wish you all the blessings, and thank you for coming.
Thank you
and
for having
speaking
me.
all this knowledge and gems.
Thank you. You did amazing.
Thank you.